To understand the tummy tuck procedure, one must first understand the anatomy of the trunk. So the first layer is skin, the second layer is fat, the third layer is fascia that surrounds your muscles of your core, and underneath that are all the important stuff, your organs, and that's surrounded by a layer of fat called visceral fat. So the first layer is the skin. If there's no skin laxity, liposuction is very effective in decreasing the thickness of the fat layer, and then the skin contracts over top. If you have mild skin laxity, liposuction does this, it makes the fat thinner, and then you can use an adjunct procedure like radiofrequency skin tightening to help contract the skin over top. Most patients with moderate to severe skin laxity, however, need a tummy tuck. If the skin laxity is primarily below their belly button, many patients are candidate for a mini tummy tuck. But in my practice, most patients present with what's called a rectus diastasis, and they have fat and skin excess, and they need a full tummy tuck procedure, which means an incision from hip to hip. So the incision is typically designed strategically, so it's low and it's hidden in the underwear line, so it's very difficult to see. So the second layer is fat. If you have good skin quality and you have excess fat, liposuction alone is very effective in addressing the fat layer. But in my experience, most patients present to my office with both skin and fat excess. So they need liposuction in addition to a surgical excision. So the third layer is the fascia. The fascia is connective tissue that surrounds the muscles of the trunk, including your rectus abdominis muscle, so your abs. With time, the fascia can stretch, and when that happens, the rectus abdominis muscles are pulled apart, and this is called rectus diastasis. So there are different reasons why the fascia can stretch. And in women, it's usually because of pregnancy. So carrying a baby mechanically stretches the fascia, and the hormonal fluctuations that occur during pregnancy help degrade the fascia and weaken it so you can accommodate your pregnancy. So women usually present to my practice with rectus diastasis below the belly button. We call it infraumbilical rectus diastasis. Men, on the other hand, have rectus diastasis for different reasons. They have more visceral fat or fat around their organs, and repeated straining from exercising and weightlifting gradually weakens the fascia and pulls it apart. Their rectus diastasis happens more upper, above the belly button, leading to that characteristic beer belly or dad bod, if you will. But they get a more protuberant abdomen that's round, while women get lower rectus diastasis from their pregnancy. Whatever the reason for the rectus diastasis, the only way to address it is to elevate the skin and the fat off of the fascia, and to look at it and to mark it, and then use specific suture techniques to bring the abdominal muscles back together. This is called rectus diastasis repair. It helps narrow the waist and it helps stabilize the core.